I have Dr. Jeremy Cauwels. He is Chief Physician at Sanford Health, joining me from the 13th Annual Becker's meeting in Chicago. Dr. Cauwels, great to see you.
Great to see you too.
Now, you just finished a panel talk on patient engagement, certainly a buzzword in any industry. Tell me how important this is in healthcare.
Well, I think it's critical to understand that in this world of 2-day Amazon shipping and the ability to get things whenever you want it, that 50% of our patients have already told us that they're willing to change providers for better access. And so as we look at that, better access doesn't just mean more appointment slots. It means the ability to deal with people virtually. It means the ability to get people, in a place where they feel most comfortable and we can deliver the care in a place where they live. And so as we make those changes, I think it's critically important that we do that in a way that's patient-centered and allows the patient to drive what they want, what they need, and how they want the experience to go.
How do we take patient engagement at Sanford Health to the next level?
I think patient engagement has to be about transparency for the entire system. We have to make sure that we do a good job of telling people, how we're going to take care of them. But then we do a good job also of feeding back to our providers, to our clinic directors, even to our CEO to tell us this is what the patients think of us. And this is what we think is going to be the most important thing about their care moving forward.
You've talked a lot before about the shift in the patient experience from the doctor will see you now to the patient will see you now. Dr. Cowell's, convenience really is key for many people, especially those younger patients who don't know they need a doctor, right? Can you speak to Google and Amazon as disruptors in healthcare?
It really is about the patient will see you now. And it really is whether you're, Google or another healthcare company or you're even Walmart. They're all looking out there to say, how do we engage in the patient at the front of an illness or when they are just looking for advice? And the question in healthcare is, can we do that and do it in a way that engages people so when they really do have an illness, we're ready, we're there, and we're a trusted partner already?
We're seeing patient satisfaction with virtual visits on par or higher with in-person visits. From your perspective, what traits will be important for the next generation of clinical leaders?
I think the next generation of clinical leaders is going to have develop what I would call a website manner. They're going to have to be able to be as dynamic on a screen as they would be in person. And so as you're looking at that, I think it's really critically important to tell people that we're willing to see you and we're willing to see you in a way that makes you comfortable. And as we do that, making sure that we're comfortable going through the screen is going to be just as important as making sure the interface and everything else works well for the patients at large.
Dr. Jeremy Cowles, Chief Physician at Sanford Health, joining me from Chicago. Dr. Cowles, good to see you. Thanks again for your time.
Thank you very much. We appreciate it.
I'm Courtney Collin with Sanford Health News.